One of the common misconceptions patients get, and which is promoted by some plastic surgeons, is that you should have liposuction and a BBL first and then have a tummy tuck later, or to separate them completely. And really, there could be nothing further than the truth. It should almost never be done that way. And let me tell you why this information gets spread. The real truth is that the people offering those procedures aren't plastic surgeons, or aren't trained to do them, or have no privileges to do them in the accredited facilities needed to be able to do that surgery. So if you have to be a board certified plastic surgeon to have credentials at an accredited facility to do those procedures. In Miami and other places like that, because of the high frequency of deaths and complications that occur, they have restricted patients, surgeons, to only have 1 liter of liposuction at the time of another procedure like a tummy tuck. Therefore, that is a very small amount, just so you know. So most of my patients are going to get much more than that. So if you're only doing a liter, that patient is not going to have a great result, and they will need additional lipo. But that lipo should be done later, after the tummy tuck, not before. All right. So those surgeons are frequently telling patients that they should get the lipo first and the BBL because they can't do their surgery, basically. So if you do liposuction and BBL first, the problem is now you're introducing permanent fibrosis and scarring into the tissues. You will get some skin tightening. You will not get as much as you think or as much as they tell you. And it's really based on the inherent properties of the skin. And the problem is you'll need revision later. And the problem then becomes now the scars can't be located as precisely. The tissue doesn't stretch. It's uneven, especially around the belly button. And there's a high need for getting a fleur-de-lis when maybe you didn't need that before. So now you're botched, and now you require very expensive revision surgery, and the result will never be as good as it was before. So keep that in mind. If you're going to have your liposuction and tummy tuck, do it at the same time with the BBL. You can stay off of your butt despite having a tummy tuck by using pillows and things like that. We do that every day in my practice, over 200 a year. All right, patients have great results, and they don't need to separate the procedures. You don't need to go through 2 surgeries, 2 risks. Ultimately, it will cost you more, especially if you're seeing the correct surgeon at the correct accredited facility. Keep that in mind, and don't be fooled by those people out there promoting the wrong thing.